And then just in case anyone's confused as to why I'm speaking, I'm just jumping on to help Casey here a little bit. So of course she's still here, can answer questions, things like that. And I should know all of you at this point, but in case there's one or two that don't, I'm Angie. I'm with the EIC and working primarily with state partnership programs, which again is why I should know all of you. And just met some of you recently, but we're still going to get into the exchange like normal. So go ahead and advance the next slide, Casey. Of course, here's our funding acknowledgement you guys all are aware of. Can skip to the next one. And just want to remind you that we do record, or we will record some of this, so we hope that you can have your cameras on for the conversation. If you can't for some reason, understand, but we will record it. We'll make it available for you to see later. There's also the pre-recordings from before as well that you can check out if you're interested in. I know we have at least one new person. Is there anyone else that this is the first meeting for you that maybe you didn't get any last year? I can't see everyone who's on. Savannah, yeah, first one for Savannah. So if you guys haven't met Savannah yet, she is the new program manager in Arizona, and we'll give her a chance to talk later on, but it looks like everyone else has been here before. So again, turn your cameras on if you're able, and we want you to be able to participate in the discussion. Should be considered a less formal kind of platform. So we have a couple people that are going to present on their updates. Do you want to advance the next slide, Casey? And so we have a couple people that are planning to give updates on their program, but we want it to be open for anyone to talk however you like to. That's kind of our plan for today. We know we have Oregon, and I believe Alaska. Was Renee able to make it on? Let's see. Renee, are you here?
You see that she's in the room.
Oh, she's here. Okay, very good, very good. And then we'll give a couple of minutes for Savannah to kind of introduce herself. She's a very good sport because she wasn't aware of these meetings. She had just started in October and didn't have the invites. So she's still willing to speak on their program a little bit. And then I don't know if is Crystal on? If she'll be able to give a program update. But we'll do a couple updates and then have discussion if you guys want to on those. But then we're also, depending on how much time is allowed, just gonna kind of throw you guys into a breakout room, one or two, depending on how many we have. And it's just gonna be for you. It's not for us. We won't be in there, and it's for you guys to discuss whatever you want to discuss as far as programs go, questions about other things, complaints about the weather. It'll be time for you guys to do whatever you want to do in those. Any questions before we get started? Very good. All right. Renee, if you're here and you're able, I think you said you had some slides, so I don't know if you need to take over the screen sharing or what we can do to help you out with that. You have the floor.
Okay, let me give you a request. Did you get that? Request to share?
You should be able to now.
Okay, thank you. Okay, you should be seeing the Alaska's blue screen.
Yes, we can see your screen.
Okay, so I was asked to just kind of do an update of what's going on with Alaska's hospital recognition program real quick. So our program in Alaska has been established since 2010. Prior to me being a program manager, it was developed by a woman who was originally actually working for HRSA, and she was in the initial stages of like the requirement for all state program managers to, develop this hospital recognition way back before me. So I had the luxury of coming into it already being established and written out, and actually having one recognition kind of set up. Actually, my first day on the job was the first recognition for Alaska back in 2015. And since then, that facility has gone through 3 or 4 renewals. I can't remember since COVID kind of messed up the timelines with that. And a couple program overall updating kind of requirements and criteria, just to keep up with the time. Our Alaska hospital recognition program has 3 recognition levels to accommodate for different capabilities and trauma systems that we have. And you see the map here, the stars indicate the recognition, the facilities that we have recognized. We have 23 hospitals in Alaska, all very, very far away. I live in Juneau, back on that far right little panhandle, kind of orange spot of the map, and it took me I would say, a night over in the Anchorage area in the yellow spot, and then another day of travel to get to the Arctic Circle in the top left in the baby blue area. And that was my last recognition in 2023 or 24. Timelines are getting confusing nowadays for me.
Hey, Renee,
Yes.
I'm sorry if you said it and I missed it. The colors, are those regions in Alaska? Are those your like EMS regions?
Those are not EMS regions. Those are hospital regions. We have 2 different regional setups, and I don't.
Okay.
Yeah.
Okay, cool. Thanks.
And I can't really speak to why they're formed that way. They look very similar to the EMS regions, but they are different in some aspects.
Nobody can ever get the regions the same, so they would be weird
Right?
if they were.
Yeah. This slide asked me to go over like what like somewhat how we get enrollment and what the application kind of looks like. And really for Alaska, it's really on the onus of me as the program manager to seek out applicants and encourage enrollment, like one-on-one phone calls, working with my trauma manager. And when she goes to do site visits, like, hey, how are they doing? Can I have a conversation when you have a conversation, kind of thing. So that's how we seek out enrollment. And I don't see a future of us just randomly getting an application. So maybe that could be a goal. I can think about that on a later date, not today. Overview of the application process. I asked the team, are you interested? When I'm having conversations with the facility, are you interested in this? You would really be a good candidate, and I encourage them to apply. I say it's really easy. I help them along the way. They form a team to kind of lead it, and essentially, I kind of does like I say this. You would be a really good PEC and a leader for this program in your facility. Would you be interested? And I really as an outsider, I don't feel like I have a lot of that authority, but I just really encourage, and I talk to their leaders too. It's like, this person's a really good person for your facility to continue to do this. Will you pay them? That question is always answered no, but one day it will be answered yes. So the facility will go through their criteria, make sure it's met. They make sure they get signatures from CEO and above saying that they are supportive of this person and team working on this program. Otherwise, it's really doesn't matter, because if the CEO doesn't want them to work on it, then there's a lot of ways to work. So that's a really important part of my application requirement. After that's done, they submit it to me, and they submit a site visit request. And this is only for initial recognition. And any other required documentation at the time that I really ask for. And because of the casual sense of the communication and the partnership I've already built, this has really never been a problem. So verification process. While they're going through the application, I'm kind of on the side forming a recognition review team. It is different for each recognition in our state. These team members, because we have a very small advisory committee, sometimes are working in the facility I want to get recognized. So I have to seek out different team members because I don't want them reviewing their own facility. That team really consists of a physician, emergency nurse, me, and occasionally the trauma program manager for the state, just because she's on site with me most of the time. The next part of it is we do an on-site or virtual or a couple different virtual meetings and visits, just really casual, but I feel like the facilities make it a very, very, very intense meeting, and I try really hard to this is okay, we're working as a team. The point of this is to make improvements and really recognize you for all the awesome work that you're doing. After all those site visits and uncomfortable things happen, the team reviews the application and documentation. Anything that the team needs more of, I go back to facility and get it, and then a formal recognition is determined.
Renee, can I
So
just jump in for a minute because someone had a question about your last slide there. Wendy's asking, how many reviewers do you have contracts with, if you have contracts with them?
I have no contracts with any of my reviewers. They are all volunteer and a part of my advisory committee. There is we did not write any rules or surrounding who needs to be on this review team. We just had it just looks familiar to the PEC requirements for a PEC team, a physician, nurse, program manager. I think that's the only rules we have surrounding that. And I will say, now that I just said out loud that they're usually on my advisory committee team, or usually on my advisory committee member, kind of one of those people already set up for this. I did use Dr. Sanso and her EMSC team on one of my reviews as a review team, just because they had been working alongside of me to make sure that recognition happened. So no, I don't pay anybody to be on a review team. That's the short answer.
Oh, that's great. Thank you.
And then the last slide I have is really what we have for marketing strategies. And I think that these are very limited. We have a very small population, but very large states. So word of mouth does work, but also sometimes it's hard when there's so many transitions of people in the facilities and lead EDs across the state. And a lot of the new leaders of each ED come from down south, and we have to kind of get them Alaskanized every time they come on board. Ask me later what that means. Another marketing strategy is just program partnership with trauma systems, or maybe the EMSC IHS program with Dr. Sanso, just having them help me get the word out when they talk with facilities in Alaska. I have an EMSC webpage that just got updated for the first time in 10 years. And I try to display facilities that are recognized and more information about the program. I have a newsletter, and then sometimes I reach out to the Alaska Hospital Association and give them draft blurbs and information about promo items about my recognition program, so that goes out to hospital leaders in Alaska. And then finally, when we do have recognition, I do reach out to department PIOs or public information specialists to share this information on news outlets and whomever wants to pick it up. And that's all I have for my update for Alaska. You guys have any questions?
That's great. Thank you so much. Renee, I'm just curious. I think you said you had 3 tiers. Is that correct?
Yes.
What are like just like quickly, what are the levels, the different tiers that you have? Like what are the criteria that you have in them?
Um, we have a comprehensive level, which is the top level. And when I talk with my trauma manager, I compare this to a level trauma two, trauma two level hospital.
Oh, okay.
Capabilities and specialties and things like that. We have no trauma one in Alaska. So our comprehensive level is the top tier and trauma
Hmm.
two kind of equivalent. And then we go down to a general level, and it does get referrals from smaller clinics, but it essentially will transition children out to the bigger hubs that are trauma two into the
Mm.
comprehensive. Does this make sense? I feel like I'm talking too much, but
No,
um,
no, you're good.
I think it's easier too if I show a map.
Mm.
My trauma two hospitals are in our main Anchorage city, which is right in the middle of our map. And that's pretty much our hub for our like elite hospital systems with specialties. And then when you get further away from that middle, you get more of a generalized kind of care. And then even further away into the Aleutian chain, that's when you're into the third level, which we call basic. And I really want to change that name. Um, so, um, and that is really a trauma level. I would say trauma level 4 is our third level. Here in Alaska, we have a new trauma level 5, and because of that, the recognition program is actually thinking about bringing back an even smaller tier to make sure we recognize the trauma level 5s and the
Mm.
clinic, the more rural clinics, and include that in the recognitions.
Oh, that's interesting.
That's to be determined.
Yeah, you guys have a lot of things that I wouldn't consider too in Alaska as far as challenges and time it takes you to get places and whatnot.
I have a plan to travel to Fairbanks in a couple of months, and being here for 10 years, I was still surprised how long it will take me to get to Fairbanks. So
Yeah.
I was like, oh, this doesn't get old. Okay.
Thank you so much for sharing. Anyone else have questions for Renee at all? Casey, if you want to pull up the next one we have, I think it's Oregon. Is that correct? Rachel Ford, do you want to take over?
Yes, give me 1 second.
Sure.
You picked the best time for when my dog was freaking out at a delivery driver. So,
The good and the bad of working from home.
yeah, it's amazing. All right. Good afternoon, everybody. For those of you that don't know me, I'm Rachel Ford. I'm the Oregon EMS for Children Program Manager, and I'm going to share a little bit of information about the PEDS Ready EMS program, which is our pre-hospital recognition program. So this was a multi-year project. I started in late 2023, gathering and reviewing state examples and then selecting the best aspects of each program. We drafted a Smartsheet based application, and then we used just Word-based application guide and FAQ. I shared the application and documents with my EMSC advisory committee, and we also had a separate committee work group. They provided a lot of good feedback, and we modified as needed. And then in early 2025, HRSA reviewed everything and provided feedback and requested more information. There were a few requests I had to respond to and made a few minor changes. I should also mention that this work was supported by passing into Oregon law some pediatric readiness requirements. So Oregon Laws 2024, Chapter 32, Section 8 states that with the advice of the EMSC Advisory Committee, the EMSC program shall establish guidelines for the voluntary categorization of emergency medical services transport agencies that meet the HRSA guidelines. So, hooray, that made it a little bit easier to actually pursue this work. And then, so as far as our application, it's a lot of the usual things that I think probably everyone is familiar with because they're in the HRSA guidelines. A couple of Oregon-specific requirements include compliance with Oregon EMS statutes and rules. Example would be required pediatric equipment or patient care reports. And then the other Oregon-specific requirement is the Hero Kids Registry. So we're requiring the agencies to have an Oregon registries for EMS app account and enroll their providers and make sure they have access. And then in April and May, all the documents and everything were finalized and posted. And then during EMS week on May 20th, we launched the program. And there's no fee to participate. I think that's probably similar, the same as everybody else. And I sent an invitation to all of our EMS transport agencies. We have, when they do their agency license renewal, they indicate who their pediatric emergency care coordinator is when they do their license renewal every year. And so I sent the invitation directly to those people. That made it a lot easier. For this initial recognition, that will expire October 31st, 2027. I'll be sending out an email reminder in August, so they'll have 3 months to renew. And then the program will have a 2-year renewal cycle. When the applications are submitted, I review all the applications for completeness. It takes about 2 to 3 hours per application. And in every case so far, I've had to follow up with the agency to clarify information and/or request additional documentation. I've received 7 applications, 6 agencies have been recognized, and 1 application is pending. And then when the agencies are recognized, they receive a certificate and a PEDS Ready EMS decal for each of their licensed ambulances. And the decal logo is on the bottom left side of the screen that you see. Also, the first 20 agencies recognized receive a PEDS Ready EMS plaque. So these plaques were an initiative of my family representative, Tammy Bakewell. And the plaques include EMS artwork drawn by kiddos from some of her families that she works with. There's 2 designs, and the one with the tall buildings, we try to send those to the urban agencies. We do have more rural plaques than urban ones, but we're just trying to make sure we send them to the right places. And then so by program, we've been promoting the PEDS Ready EMS on our website, of course, and then I send out bi-monthly newsletters to all of the PEDS coordinators. And then I've been including information in the State of Oregon EMS program quarter reports that go out to a lot of people across the state. And then I continue to request that my committee support with outreach to their area agencies and post things on social media and share info at other meetings where EMS is present. And examples of that include like our area trauma advisory boards and the EMS section of the Oregon Fire Chiefs Association, things like that. There have been several Peds Ready EMS sightings in the wild. So recognized agencies have shared social media posts, photos, and a local newspaper article promoting their Peds Ready EMS recognition status. And to encourage additional applications, I've included these examples in the Pediatric Emergency Care Coordinator newsletters. And one of the agencies, Polk County Fire District Number 1, they produced a video, which we will watch now. If it works. Don't think it's playing. Or I'll send you a link.
Yeah, we just tried it a few minutes ago and it was working.
Yeah.
I can, if you would like, I can share my screen and play it from my side.
How about I finish with the last slide and then we can do that.
Perfect.
All right. So my goal is to have 25% of transport agencies recognized just as an initial benchmark. Some of the next steps that my committee has proposed are developing a learning collaborative with agencies that have been recognized, and that will probably live on a base camp site. And then also engaging with our EMS supervising physicians and medical directors and bring them on board with that. And with that, I'll stop sharing so that Casey can share.
Rachel, while you're getting ready to play that video, I'm curious, what do you kind of envision for the learning collaborative with the agencies involved? That's a pretty interesting idea, to keep them engaged in that, I guess. What are you thinking for that?
I have no vision yet. That's
Just it's in the plan. Yeah, I think that sounds like a really cool opportunity.
yeah, it's an idea at this point.
Polk County Fire District is really proud to be one of the first agencies in the state to be recognized as a PEDS Ready organization. This is the recognition from the Oregon Health Authority that we have gone above and beyond on our training, preparedness, and equipment to make sure that we can handle all sorts of emergencies, especially those for our children. We have equipment that allows us to care for even the smallest of patients, and we've identified areas where we can improve in our readiness. This certification is something you can apply for through the Emergency Medical Services for Children Committee that's run by the EMS program of the Oregon Health Authority. This certification allows others to see that we are ready for all types of pediatric emergencies. For us, it's just one way we can show our community that we care about doing the best we can for all of those that live here.
I would just add, if you have any questions about the program, everything is posted on the EMSC program website, the application guide, and the frequently asked questions, or you can, of course, contact me directly, or you can ask questions right now.
That looks like we have a couple people curious about sharing the video link. That video was awesome. Did they do that on their own, or you worked with them to put that together? I missed what you said about that.
They did it all on their own.
Oh, that's incredible. That is really cool. Well, if you are able to share it in the link, a couple people are asking about that, maybe to be able to do similar things. And
Polk
then
County Fire.
I just had a question about your application process, because congratulations on almost having a full year. Are you doing it like ongoing applications, or you have set times that people can apply to keep it like on the same cycle?
Right now it's just rolling in, and I think
Okay.
it'll continue to be that way until everybody's in. I wouldn't ever reject anyone from applying.
Yeah, I know that that's been a conversation in other times where people were saying, you know, about doing it limiting to certain times or ongoing. That was a conversation we had before.
Yeah, I don't think imposing any barriers
Yeah.
would make sense.
Just trying to get them whenever you can. Thank you for sharing that. Any questions for Rachel or Renee? We have one on hospital and one on pre-hospital, so getting both ends of the spectrum here.
I'll just add that I started with pre-hospital because it felt like the easy button. I feel like the hospital landscape is tricky. And so if if you haven't started one of these yet, that would be my 2 cents.
I can appreciate that too. I think depending on your background too, if you have a hospital background, maybe some people would think hospital is easier because you know people, but I tend to think the EMS side is a little bit easier too. All right, so we have Savannah from Arizona who started in October. I'm not sure if anyone's had the chance to meet her yet. And we surprised her yesterday with being on this schedule. So she very graciously agreed to talk a little bit about the program that is already established in Arizona. So Savannah, I will let you take it away.
Hi, everyone. Very nice to be here. I do not have a formal slideshow or presentation because of the quick turnaround, but that's okay. So I'm the new EMSC program manager for Arizona. I started in October, and for Arizona, we have both an EMS recognition program and a hospital recognition program. I will start with the EMS one just because it's a little bit shorter. So that launched last year, 1 year ago in January. And so far we've had, I believe, seven EMS agencies recognized through that program. We have ongoing or rolling application period for the EMS. For us, it's called the Making Arizona Ready for Kids or MARC program. So we have a rolling application period where people can apply anytime throughout the year for the MARC program, and then when an agency does apply, they submit their application and it's reviewed by our Pediatric Advisory Council for Emergency Services, which is our statewide PEDS EMS council. And then upon approval, they will get decals for all of their vehicles, among some other different prizes, not prizes, but recognition items. So that program currently, this year, so far, we haven't received any additional applications. I'm planning to do a little bit of marketing and promotion around that program this year. I think because it's so new, maybe people here in Arizona are unaware of it, or what the requirements are, or what the benefits are of applying. So that is an interest of mine. If anyone has really done some marketing and advertising of their pre-hospital recognition program, I would love to hear more about that. And then switching over to our hospital recognition program, it was created by EMSC. This was long before I stepped into this role. So this is all information I have been told that I am now retelling. So hopefully I can get everything right. But our hospital recognition program was created by EMSD for Arizona. And then once it got up and running, we handed it off to the Arizona chapter of the American Academy of Pediatrics. And so our hospital recognition program for peds is now housed within AAP here. The goal for that was just sustainability. Now that they have that program, they're the owners of it. We, meaning myself, the EMSC program manager, and also our FAN, are a part of the program's steering committee. So we still play a large role in guiding the program and collaborating with other members of the steering committee to help however we can with the hospital recognition program. In Arizona, it's called the PPEC program. And so also for the PPEC program, They have 3 different levels of recognition that hospitals can apply for. I just pulled it up. So they have, it's called prepared care, prepared plus care, and then prepare advanced care. And to submit an application and to become certified, through the hospital recognition program, there is a fee for hospitals associated with that. But they discount that fee for like IHS hospitals and critical access hospitals as well. So throughout the year, we also, in addition to being a part of the steering committee for that program, we participate in site reviews. So when a hospital or an ED does submit an application to hopefully be recognized, we sit among other PPEC member hospitals employees on the site review board for each site. And so we provide recommendations. We go through all of their documents and different items that they've submitted. And then there is AZAAP, it does have a base camp for all of the PPEC member hospitals. And so that is currently really utilized by the person who manages the hospital recognition program at AZAAP. But it's an opportunity also, I think, for EMSC here for me in Arizona to promote different educational opportunities and to the PPEC member hospitals that have been recognized. So I think the total number of hospitals currently recognized is I want to say 29 or 39. I don't remember exactly. So yeah, apologies for not having a formal slideshow, but that's a little bit about both our EMS and hospital PEDS recognition programs. Happy to do my best to answer any questions.
Thank you so much for doing that. And no worries about the presentation. We kind of surprised you with that yesterday. I think that's really interesting. I don't know if you guys caught that, but the recognition program for the hospital. So it was developed. And do you know, Savannah, were all 3 tiers developed by the EMSC program before AAP took it over, or did they make changes once they?
That is a question I do not know the answer to.
Yeah, that's really interesting though. I don't know. Has anyone else had interactions with AAP like that where you're looking at maybe transferring the program over to them to run it? That was news for me to hear it from Savannah. I thought that was interesting. We have, so Savannah mentioned this, and then Chelsea also seconded that idea. Casey put some things in the chat, but conversations about marketing. So if maybe just a couple of you could give an idea of how you've marketed either of your programs to this point, or some things that you're thinking about if you're starting it, what are you thinking is the best approach, or what has been the best approach for you? I'll give you guys a couple of minutes for that. Oh, Rachel said that maybe AAP was always in the lead of that program for you, Savannah.
I thought that Tommy was the lever for it, though. I think AAP was primarily supporting the on-site verification visits, but Tommy was the one who really took the lead on helping to create the program. Isn't that right, Rachel?
Yeah, that's what I meant. That Tommy was like working directly with AAP collaboratively to get it done, and then they launched it under their banner. AAP did.
That's great. Thank you. I appreciate. I'm glad other people have more background than I do. There was no like historical information about this for me, so it's all
Yeah,
word of mouth that I've
they
learned.
just give you everything all at once. All right, so anybody have comments or thoughts about the question about marketing, how you're marketing your programs.
I think I mentioned it in my presentation, but the newsletters I think are good. I send information out to the area trauma advisory boards. So I send a quarterly update to them for the EMSC program, and I include information about Peds Ready EMS in those. I send it out to my health security preparedness folks that also work with EMS agencies in their work. I think just early and often, just keep pushing it out there. I think that's the best you can do.
Yeah, that's right. And I'm glad you brought up newsletter too. If anyone has newsletters, we love to be a part of those. So if you want to send a link to any of us to register, Rachel or myself, we're trying to kind of keep more updated on those things too, because we can see some pretty interesting stuff in there. I like to get those updates. All right, other folks, anything on marketing or what your ideas or thoughts are? Dwayne, you have a program in Pennsylvania. What do you do for marketing? Dwayne left the building. Kyle, you have a monthly newsletter. Can you send us the link to it? Do you have a link to register, or you can send it by email too? Yes, Rachel's on it. All right. So what we're actually, Casey, can you bring back up the agenda? Just make sure we didn't miss anybody here.
You covered everyone who was able to join today.
Okay. So what we're gonna do now is just put you guys into a group chat by yourselves into a breakout room. We're not gonna be part of it just because it's kind of for you to have conversations with each other and be engaged and actually talk about the questions that you have, whether it's about topics today, like whatever recognition program you're on, or maybe you have some other things. We know we have a few managers that are newer within the last 6 months or so. Maybe you have some questions for managers, but we'll go ahead and put you into breakout rooms. I don't know, Casey, do you want to do like 10 minutes? See how that is? And when we come back, if you want to give an update to the group about conversations that you had, maybe other people are interested in them. But it's your time to do. Oh, sorry, I was reading Rachel's comment. So Rachel, you're talking about the marketing that you're requesting time on other people's agendas to go in and speak. Yes, okay. That's a good idea too. You have a lot of really good ones. Thanks for putting those in. But yeah, we'll go ahead and put you guys into a breakout room and then we'll see you back in 10 minutes. So hopefully you can have some conversation with each other.
Back in the main group.
Welcome back, everyone. Hopefully you guys had some time to chat with each other, and it's nice to see some of your faces now too. Anyone have anything that came up in your group that you want to talk about with the large group?
Rolla had a question for Jacqueline, if maybe we could have her finish, I guess, the collaboration she has with her, what was it, HPP, Corolla? Was that the question for her?
Yep, HPP or the Healthcare Coalition, whatever they address it as.
Yeah. So our office is housed within the Department of Health, which is actually under Title 19, the regulatory department throughout the territory. And so the preparedness program is also housed in the Department of Health. And through HRSA, we have our signed collaboration and agreement. So they work hand in hand with us in terms of helping us in EMSC. In September, we just completed a mercy exercise. And so now we're doing the pediatric ready exercise. So we do work hand in hand with them. They sit, matter of fact, 2 of them sit on our advisory council.
Thank you.
Anyone else have anything that you want to bring to the larger group or topics that were interesting that came up?
Well, since my mic is open, I was just letting them know that in the Virgin Islands in August, we got our pre-hospital recognition program approved. And yesterday, we got email back saying that our ED recognition program was approved by HRSA. And I'm telling you, it was a lot of work. And I was really surprised that this thing came back and didn't ask us to make any changes at all. So we have a silver tier and a gold tier. And I was telling them that what we were doing was laying the foundation prior as we were writing the recognition program in terms of making sure that they got their education. And we brought down the National Association of Nurses. And so we got all our ER, NICU, PEDS nurses. They did the TNCC, the ENPC. They did NRP, PAIRS, and all of those pediatric training that and assessment and awareness programs that needed to be done. And we also did it for the pre-hospital. And the excited part about the pre-hospital part was I'm also a EMS educator. And so I tell them, look, y'all want to gain pediatric readiness. And so they lost their training officer. So they asked me to do some refresher courses. So I had the opportunity then every day for the whole of October 2025. I did every topic required for their recertification. And sometimes when they come into class, they go into 5 or 6 breakout groups because I had 36 people in the class. And they had their skills checked prior. Some lectures, they had their skills checked after. And then the last day of the education program, we did an operational exercise drill, and we did a quick little tabletop, and then they actually had to go out, and we had 20 kids all moulage, and they had to sort them by categories. And I mean, real life stuff. I had a Burton mannequin in the bathroom who delivered on the floor. So when they went in, the mannequin is sitting on the floor, and the baby's on the ground with the umbilical cord hooked up with the afterbirth. And we actually video it. I sent to my project officer some of the pictures. But that was one of the ways that we know for ourselves, because when I was running EMS, every quarter we had to do skill check. And every quarter the training officer had to ride with a different shift to see them in the field. So I was happy that I was able to work with that agency. And tomorrow we're dedicating 6 brand new ambulances to the territory. Thank you. Over.
Congratulations on all of that. That is incredible to hear all those updates from you. Anyone else have anything you want to add? I just want to say again, thank you, Renee, Rachel, and Savannah for your presentations today. I really appreciate you guys doing that. And Margot and Aaron, Mark, nice to see you guys. Renee on camera too. Thank you. So if you want to bring up this slide, Casey, about our next meeting. So we have the plan kind of laid out for this year, and you're going to see more of what we just did today of having the breakout sessions among yourselves, and the topic discussions led a little bit more from you all. And if you remember last year, Casey, I forget what time, end of last year, you sent out the survey about topics and things that you are interested in. Casey did a very good job to go through those and kind of map out some areas of interest. And one of the ones that came from Emily, thank you to Emily if she's still on, was a question about which states have incorporated pediatric readiness into part of their trauma rules. So that'll be the topic for next month. So if that's something that you are working on in your state or you have interest in, or maybe it's already incorporated, like in Texas, that'll be something that we'd like to hear from you about so that we can help have you facilitate some of that discussion. We're going to reach out after this to all of you guys to kind of recap that. But Casey, do you want to talk a little bit about the speakers for next month too on that topic?
During next month's session, we are going to have Dr. Craig Newgard and his team. They are going to share a 5 to 10 minute update on some of their upcoming work. Kate, if you're available, I'm sure you can speak to it better than I can.
Yeah, just very briefly, it's essentially a qualitative assessment of some of the barriers and levers to pediatric readiness within trauma centers. So they're working with verified trauma centers and contacting them and talking to them a little bit about the culture and the challenges that folks are facing. I think it'll be a very formative kind of report that can be addressed. So they just wanted to share a little bit about that work that they're doing.
Perfect. Thank you. So again, that'll be February, was it 19? February 19 next month. So you should have those calendar invites. I think Casey had already sent them out for the year, correct? If you have questions about that, bring them up. And again, if you have other topics or things that come up as we're here, please bring those to our attention too. But expect to have more time in the breakout sessions because again, this time is for you guys. You know, this is the time that you asked for to be able to get information from each other and maybe learn and ask the questions that you want to do. What do we have next, Casey?
That's it.
That's it. So any other last questions, comments, complaints from anybody? Then we will cut it a little bit early, just 18 minutes, and hopefully see you guys all next month. And thanks again to Renee, Rachel, and Savannah for talking about your state's programs today. Everyone have a wonderful rest of your week.
Everybody, great presentations.